Welcome back to the Health Elevated podcast. We're very excited to talk about health insurance today. And we have a special guest who is an expert in this area as he's worked in that industry for a number of years for a number of different places. And his name is Andy Browning. And so, Andy, unfortunately, sometimes you hear some negative stereotypes about health insurance in the news. I just want to ask to start us off here. Are there reasons to actually be mad at health insurance, or are the criticisms against health insurance legit, or are they just wildly over exaggerated?
They likely are wildly exaggerated. I think there are some legitimate criticisms, really, if you're looking at complaints about the entire healthcare industry. The healthcare in the United States needs reform, and there are issues with it. Health insurance is just one component of that needs reform. Unfortunately, that is the one area that people typically look to for reform. Most of the debates about healthcare reform are related to how do we pay for healthcare, less focused on the delivery of care and the inefficiencies there.
I have been frustrated with health insurance before. I've learned a lot more over the years, and I would say my frustrations with health insurance have probably come from not understanding the policy. I think another frustration I have comes from the fact that our employers generally provide the health insurance and they determine what the health insurance coverage is. And a lot of times that information isn't exactly clear. And I also just fundamentally don't think that your employer should have anything to do with your access to healthcare, but that's a side issue. We're talking about the insurance side here. But I guess that, with that, previously I expressed that I wish that we didn't have to deal with it. What would happen if we didn't have health insurance? Is it actually necessary in the long run, in the kind of I guess, the global healthcare economics perspective? What does that do for the individual consumer cost of healthcare?
If you look at the way healthcare is delivered, if for your run-of-the-mill office visits, you're going to see the doctor because you you have the flu or simple routine care. Those types of services in a more free market environment would be less expensive. Um, Physicians, doctors' offices would have to post their prices up front. That's one of the frustrations a lot of people have is you go to the doctor, you go to the hospital, you have no idea what you're going to be charged until 2 weeks down the road when you get the bill. In a world without health insurance, you would know those prices up front. Now, the challenge is medical care makes up a very small percentage of total healthcare expense. The real healthcare expense comes from chronic illnesses, or other unexpected high cost events such as cancer, serious accidents, car accidents, premature births. That's where the bulk of the expenses come from. So if you're looking at a situation where there's no health care, no health insurance, and you get in a car accident, you can be looking at 50,000, 100,000, up to $1 million medical expense that you simply cannot pay. So that's really the primary focus of health insurance. The primary goal of health insurance is to help mitigate those high dollar expenses.
You said doctors would have to post what they were doing, or post their prices, but don't we have the No Surprises Act that makes it so that healthcare costs won't be a surprise to the consumer after the fact, so that the cost has to be well known?
The term well known is where the challenge comes in is that, yes, there's the No Surprises Act and other legislation out there about price transparency. The intent is to make prices known ahead of time. If you look at the actual implementation of those laws, it's very complicated. Not only do medical providers have to post these, hospital, for example, might go through and list, here's our charge master. You as a consumer, that doesn't mean anything to you. You want to know, I'm going to go in, I'm going to have a colonoscopy. The prices actually, or the cost of that service could vary depending on what you have done once you get there. Does the procedure run long? So there's more anesthesia involved. So the price is not going to be what you expected it to be. Are there other things happening within that service that impact the cost? So it's really hard to really get that picture up front to know exactly what you'll be charged for. Other than if I go to the doctor's office, they're very good about the regular visit's going to cost this much. Depending on how long the visit is, they might charge more. But those are simple services. The more complex services where there's a lot of unknown about what's going to be done, it's been very difficult to really get the true price transparency on that.
Interesting. So I'm curious, you talk about the principal price drivers really come down to those unexpected procedures, unexpected long-term care pathways. But as the individual consumer of healthcare, I guess the individual daily consumers of healthcare, those getting your strep test for yourself or for your kids, vaccines, those kind of things. Um, is that where you think that there is some friction points because there's this delineation between those really high cost things where insurance works for you versus the day to day things that we get more exposure to, but they're the times when insurance does not necessarily work for you.
Absolutely. And as you look at the market, or the healthcare population, roughly 80% of the expenses come from 15 to 20% of the populations. And so, as we talk about the number of people who would be impacted by no health insurance, the ones that are really impacted are impacted heavily. Broader population might be okay without it. But if you are one of those unlucky few, unlucky 15, 20%, that puts you in medical debt, puts you in bankruptcy, which is already medical debt's already a problem with even with insurance. It really is damaging to those people. One other area that really could impact care and the health of the population with insurance is these high dollar expenses typically are borne at a hospital. So if you look at a hospital who suddenly has an influx of patients who are unable to pay for their bills, they have to start making decisions about what kind of care they provide. Services, specialty services, they might just stop providing because it's just too high cost. You have a lot of people not being able to pay their bills as there's a lot of medical debt that has been written off by providers, which means that less profitable areas, less profitable hospitals might have to close the doors. This really impacts areas like rural communities or low income areas where a medical delivery system, a hospital system might decide it's just not financially viable for us to remain open there. So we're going to close our doors. Where in this world with insurance, a lot of that, a lot of those payments are subsidized through medical payments by the insurance company.
Yeah, and that's actually, I just want to throw in there, that's a real world issue that you're bringing up. So I think we mentioned previously on the show that I live in an area that many consider to be more rural, and the local hospital just recently stopped providing some specialty care sites because they were not financially viable. And that has consequences to the population whereas previously that hospital was a catchment center within about a 2-hour radius. Now for patients to get those needs, sometimes which are emergency needs, now they have to travel much, much farther to get those needs. And there's something called the golden hour after an injury, where if you can get care within that hour, your outcomes are much, much higher. And when hospitals are unable to provide some of those specialty services, that golden hour becomes unobtainable. And so there are very real consequences to do just what you described there, Andy. And just yesterday, in fact, I was talking with an individual who needed one of those specialty cares those specialty lines of service that is no longer offered. And that individual described to me what the outcome was like after this. And it's heartbreaking, honestly, in many ways. Yeah. So with all of this, so you're arguing healthcare or the healthcare is divided into kind of multiple components. One of them is the actual providers. The other side is the side that funds everything, the insurance side. And that both are really necessary is what you're arguing so that we actually have access to care. But with that, I'm reminded of a quote from the old movie, My Big Fat Greek Wedding, where one of the characters says in their household, the man might be the head of the house, but the woman is the neck and she directs where the man looks and what the man's able to do. It seems to me in some ways in healthcare, the providers, the ones who are making the decisions, but the insurance is the one that allows those decisions to happen. Is that a complete wrong way of looking at things, or is there in fact is there a way that the health insurance side of healthcare actually provides a regulation on the overall healthcare industry?
I think you hit it right there as you're posing that question. That's where my mind went is I would perceive that as a negative in the sense that the health insurance companies help direct where care should be provided. Consumption of healthcare is different than any other um, service out there. If you look at car repair, your car breaks down, you go shop around, get word of mouth. What auto mechanics provide good service? Which ones can we trust? Which ones are provide fair prices? For most healthcare decisions, we don't have that opportunity. We need healthcare when we need it. We don't have the ability, despite efforts to provide price transparency, we really don't have the ability to shop around. An insurance company does that for you, really, when you think about it, is we negotiate with providers for fair prices. We argue fair prices to ensure that providers aren't overcharging for certain services. We'll look at services of deem them as not effective services. Now that does create frustration for people in the sense that, hey, my doctor says I really need this. Why won't you pay for it? The healthcare industry as a whole has decided this is an effective type of service. We'll make sure that the providers on our panel are good quality providers. So we're doing all that pre-shopping for you. We're making sure that, like I say, prices are competitive. We have quality providers, and they're providing appropriate service. So really, as much as possible, we're really an advocate for the patient, an advocate for the members of our plan to make sure that they are getting the right service. And to your analogy, that we are providing that regulation to the healthcare industry.
I believe that many, if not all, health insurance organizations actually provide a service called member advocacy, where you're able to call in and work with the insurance group within your situation, your outcome. Is that correct, or am I way out on a limb by saying that?
You're absolutely right, and that's what's greatly unused service the insurance companies offer. We have member advocates, like as you mentioned, is that you could call your insurance company and ask to speak to a member advocate, and they'll help direct you. I need a new primary care physician. They'll help you find one in your area, one that the plan finds is meets. They would determine meets your specific needs. Same with specialists. Same with other care you might need. They help direct you. On top of that, we have, in addition to member advocates, we have nurse care managers. If you have a chronic condition, if you have a hospitalization, they help you guide you through the whole healthcare journey. You mentioned early on in our conversation about how confusing insurance can be, how confusing the healthcare system can be. Our member advocates, our nurse care managers really help our members navigate through that, answer questions you might have along the way. So we're really there to offer not just, or more than just paying for the claims, paying for your services. We're also helping guide you through the system.
That makes a lot of sense. One thing that I'm thinking about is a lot of times where the rubber hits the road and the news kind of takes these sensationalized stories comes in the form of denied claims. And I think that makes a lot of sense where, as you described, the health insurance is here to help negotiate, find those best deals for you. Because, as you mentioned, when you have an injury or like you need health care, you don't really have the time oftentimes to sit there and shop around. And the insurance is able to do that for you, negotiate the best deals. But if claims are being denied, and it seems there's this balance where maybe, and this kind of does depend on the different companies, I think, have different rates of denial or different reputations of denial, that sometimes over denial can happen, or at least almost like these false positives where they deny something that maybe shouldn't have been denied, that should have been like some type of care that the patient should have received. Are those kind of just rare occurrences that kind of get magnified because like occasionally bad things get denied and then becomes a sensationalized news story? and it kind of gets everyone up in arms against insurance. Are those like rare than the population or that the news and the media might make us believe? Like, for the most part,
Let's
does it work as a system?
as a whole, I guess at the grandest level, yes, it does work as a system. I will say once again that the U.S. healthcare system is fundamentally flawed. There's a lot of things wrong with it. I think there are bad actors in the insurance industry that over deny claims. I've been fortunate to work for an organization that I can confidently say they do not do that. They really are in it for uh, serving the members the most appropriate way. There are some very sensational stories out there. Uh, a company that just basically denies everything and will pay for it if you appeal, but you have to go jump through the hoops to do it. I think that is less common. I think it is sensationalized, but it doesn't mean that it doesn't happen. And those are things that need to be addressed and whatever the regulation where might be around it to call those things out.
Yeah, I think framing health insurance as a way to protect the member from not being overcharged from the provider is actually like a really good way to think about it because health care can get really expensive, as we already talked about, that certain procedures, emergency in particular, hospital, can get in the hundreds of thousands really quickly. And there's a question, I think, of like why it needs to be so expensive. And I get that there's a lot of reasons behind that could be a whole other podcast of like why like they try and charge so much. But at least insurance can be there to soften the blow, minimize it as much as possible, and pre-negotiate to really for just the members' benefit. So I just wanted to say that I think a good way to think about this stuff. But David, you were going to say something.
Yeah. So often talk about what, like what we care about, what Riley and I care about is people being healthy. And part of that is the access to care. Part of that is daily habits. But I wanted to ask you, to me, a very direct question, perhaps. Can utilize, can your health insurance, does our health insurance actually help us live healthier lives? And if so, how can we better use our insurance to help us be healthier?
Great question. And really, there's a lot of benefits to the insurance company that go on you. State the obvious, the insurance company would be the most profitable if they had very healthy members that never have claims. And so it's in their best interest to make sure that those that they cover have the opportunities to be as healthy as they can. So you'll see services, wellness benefits within insurance companies. Some of them offer discounts on gym memberships or free gym memberships. Other things that they incentivize you to have an exercise plan. 10,000 steps a day will get you some benefits. Look into your insurance company, see if they offer these types of benefits and really take advantage of them. The other really key component is the cancer screenings, any other health screening to take advantage. Those are usually low cost because it really benefits us to identify those conditions early on. So if you are of an age where it's recommended for you to get breast cancer screenings, colon cancer screenings, take advantage of them. The insurance company is going to pay for them because it benefits them for you to do it as well. Any routine visit, go see your doctor, your annual visits once a year. Those are usually very low cost through your benefits. Really, just take advantage of the services that are offered by them, either for prevention, for healthy lifestyles, whatever it might be. Is there's really a lot of opportunities out there to utilize those benefits that are made available to you.
Thank you, Andy. And just a tie-in for all the listeners. So not long ago, we met with Dr. Kirk Knowlton, a cardiologist, and one of the things that he said to live your healthiest life possible is to know your numbers, and you get your numbers from exactly what Andy just said, those regular check-ins where you can get those screenings done. And so that ties right in, Andy, with what Dr. Knowlton talked to us about with being healthy.
And that is kind of right in line with what we call a 1 minute for 1%, where we like to give actionable advice in about 1 minute to help people have something that they can do to improve their health by about 1%. And so I think you already hit a lot of that, Andy. Is there any other steps that someone could take in order to kind of just like a minimal step they could take today to try and like take advantage of some of the stuff you're talking about?
Well, I think the biggest thing is we spend a lot of time here talking about the financial aspect of healthcare and how to pay for it, but really the number one issue with U.S. healthcare system is the health of our population. My 1 minute is say, get out there, get exercise, just simple walking, moving around, make good diet choices. I think for the most part, and people say, what's the secret to weight loss? We all know what it is. It's very simple. Eat right, get exercise. So I think that's number one thing for me is live the healthy life as possible. Once again, take advantage of the opportunities that you have out there through an insurance company that might offer benefits. Go see your doctor regularly, all those types of things. But really, it's the insurance company has this perception of being the unnecessary middleman that's just there to take your money. But really, we're serving a purpose to live your healthiest life. We really, if nothing else, even if we are greedy, our best opportunity to make money is for you to be a healthy person. And so that's really what the focus should be on.
But you've certainly kind of changed my perspective on health insurance. Listeners, let us know if your perspective has been changed. We'd also appreciate a comment or review. But thank you for tuning in to Health Elevated, and we'll catch you in the next one.